Hello everyone, I'm Dr. Archita Goyal. Welcome to Decode. Don't forget to like and subscribe. Let's decode together. So, today we have a 22-year-old female patient who presented with adduction deformity at the wrist joint. She also gets flexion deformity at the proximal interphalangeal joint along with hyperextension at the metacarpophalangeal joint of the middle finger upon wrist abduction. Right, very apparent in this video. So MRI scan was done for this patient. Here you can see that there is mild to moderate atrophy of the flexor digitorum profundus muscle along with flexor pollicis longus, pronatus quadratus muscles, right, and also flexor carpi ulnaris muscles. The neurovascular bundle, however, appears normal. No abnormal signal changes were seen on stir images. MRI of the middle finger was also done for this patient. Here you can see that there is cord-like thickening of the flexor tendon, right? This is likely due to contracture. So this is not a very typical case, but then again it is one of the spectrums of Volkmann's ischemic contracture. Patient probably had a neglected compartment syndrome, due to which the atrophy of the muscles happened. Post your queries in the comment section, and thank you for watching this video.